My name is Maureen Baumgren, and I'm the nurse here to assess you. Could you tell me your name?
Margaret Taylor.
Okay, Miss Taylor, could you give me your birth date?
January 28, 1996.
Okay, Miss Taylor, I want to ask your permission today. I have to touch your chest and your back. Is that okay?
Yes.
Okay, and I want to ask you some questions too about your family history. Do you smoke?
No.
Have you ever smoked?
No.
Do you have any history of lung problems?
No.
How about do you have a family history of any lung problems?
No.
That's great. Okay, I'm going to start my physical here is inspection here, and as you can see, Miss Taylor's skin color is appropriate for ethnicity. There is no pallor or cyanosis around her mouth. Her complexion is not ruddy, so that is good. You can also tell looking at Miss Taylor and look at her hands here. Look at her finger. Now, normally we would not have fingernail polish on, and without fingernail polish you could do capillary refill, but I'm going to do it with the fingertips instead. If you press them, the color comes back right away. That shows good capillary refill. Also, look at her nails beds. If it was less than 165 degree angle, if it was more than less than 100, I'm going to get this all messed up. If the angle of her fingertips were angled, it would indicate clubbing, and that would be under 165. I'm going to get this messed up here. Anyway, her skin, her hands are a good temperature. They're warm. They're dry. Her skin looks dry. If you look at her now, if you look at her sitting upright, her posture is upright. She's not leaning forward. Leaning forward would actually indicate, it's called tripoding, and people who have difficulty breathing sometimes tripod. My mother had congestive heart failure, and she sat in a tripod position. She also is not doing pursed lip breathing. A lot of times, patients that had difficulty breathing, they do pursed lip breathing, so she's not doing that. So, but her chest is symmetrical. You can see that her sternum is straight, and if you look at it from an angle, it's there's no sinking. Sometimes people with breathing difficulties, they have a sunken chest. I think it's called flail chest, but hers is even. Okay, Ms. Taylor, I'm going to examine you from the back here, and I actually need you to sit on this stool here. I'm going to move this up here for you, and save this chair for myself here. So you just back to me here. That's good. Okay. What I'm going to check for first is your scapula, and that's the shape and configuration of your chest wall. It's symmetrical in the back, right here. And if you look at the scapula and her back, they're even, and they're horizontal and in line with her shoulders as well. Okay? Okay, we're looking also for the use of any accessory muscles with breathing. She is not using her trapezius muscle to breathe, so it doesn't look like she's making any extra effort to breathe. That's great. Okay, I'm going to palpate for tenderness right now. Okay? If that's okay if I touch your back?
Yes, ma'am.
Okay. And we start at the apices here on the left. I use the middle finger of my non-dominant hand. And you can hear its resonant sound. Shows them over lung field here. Go down. Hope you're not ticklish here. I'm going to check under the lateral aspects of your lung as well on both sides. Okay, Miss Taylor. Okay. All right. I'm going to also check the surface of your back here. I'm going to palpate it for lesions and masses. Is that okay?
All right.
Okay. I'm going to start on the left-hand side. So palpate both symmetrically. And really, when you're checking somebody, you're also checking for symmetry. You're not just checking the left side or the right side. You're also checking symmetry on both sides. I'm using the my fingertips. Okay. Did you feel any tenderness there?
No.
Okay. There's no tenderness. Okay. And I didn't note there was no lesions or masses there. Okay. I'm going to listen to your lungs. I want you, whenever I place my stethoscope, I want you to say 99. Okay.
Okay.
Okay. Sorry about that. Whenever I put my hands, I want you to say 99. Okay. I want you to say 99. I'm going to use the ulnar part of my hands.
99.
Okay.
99.
Okay.
99.
Okay.
99. 99. 99.
Okay. And I can feel vibrations, and that would be
99.
normal. Okay. Okay. I'm going to also do your lateral part of your lungs as well. Just need you to.
99. 99.
Okay. I think I got bone there. Here, try that.
99.
Okay.
99.
Okay. Thank you. Okay, I'm going to test your chest expansion here in the back, and I'm going to do is put my thumbs on either side of your spinal column and kind of pinch a little bit of tissue. And when I tell you, I want you to breathe deeply for me.
Okay.
Breathe for me. Okay, and you can, the camera person probably we're going to see this, but you can see the spreading part of my fingers. It's symmetrical. See? Do that again. Okay, thank you. I'm going to percuss for tone at your APCs and across both your top of your shoulders. And I'm going to do this. Take my finger and go across your APCs, which the lung fields and back. You hear a resonant sound there. Okay, and I'm going to go check. I'm going to percuss the intercostal spaces across and down bilaterally in your back here. And intercostal spaces are air-filled areas, so they should also have a resonant sound as well. Okay, and once again, I'm going to do the lateral aspects. Okay. All right, thank you. Okay, and I'm going to do a test called diaphragmatic excursion. Now, this test maps out the diaphragm's movement from full exhalation to full inspiration. And what I'm going to do is I'm going to make some marks on your back. They'll easily wash off, okay? What I'm going to have you do, I'm going to explain this first. I want you to exhale all the air out of your lungs, okay? And when I tell you to, then I want you to hold it. And then when I finish doing that, then you can breathe easy. Rest for a second, okay? We'll start with this. Okay, I'm going to tell you when. Here, start. Okay. Take a deep breath out. And then hold it. Okay, I'm sorry, I wasn't ready here. Let me see. I need to get my pen here ready. Okay, just take a nice deep breath in again, please. As you breathe normally. Okay. Okay, I want you to breathe out for me. Exhale for me. Okay. Okay, now breathe normally for me. Okay. Now what I'm going to have you do next is I want you to have you breathe in, and then I want you to hold the breath in. Okay. 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 Breathe in and hold the breath for me. Okay. Okay. You can breathe normally. This ends up being 3 centimeters, which normally could be 3 to 6 on a normal person. Now, somebody who's very athletically inclined may have 6 or 7. Okay, I'm going to do the other side again. I want you to exhale all the air out. Okay. Okay. And then hold it. Okay. Breathe normally. Okay. All right. I want you now to breathe in deeply and hold the breath in, okay? Okay. I should have had a smaller pen here. This is getting ink all over my hands here. Okay. And the wrong side of the ruler. Okay. And they are the same. They're both 3 centimeters. That's the idea. Is when you're measuring them to measure they're symmetrical, and they're even on both sides. Okay. Thank you so much. All right. Now I'm going to look the shape. Okay. Okay. Let's see. All right. I'm going to auscultate your breath sounds, and at the same time listen for adventitious sounds, for any sounds that are not supposed to be there. Okay, I'm going to warm my stethoscope in my hands and clean it off here for you with the alcohol wipe and warm it up a little bit. Okay. And I'm listening. I'm going to start at the apices, and I'm going to go down. And I'm listening for normal breath sounds. If they were adventitious sounds, it could be crackles, which sounds like your hair being rubbed between your fingers, or it could be adventitious sounds. It also could be wheezes, which are high-pitched, shrill sounds. Okay, I'm going to start at the apices right here, and I'm going to listen, and I'm going to breathe in deeply through your mouth, and then out. I'm going to listen through one cycle for each sides here. Okay, I'm going to also listen to your lateral aspects here. Okay. And on the right side, you have 3 lobes, and we can really listen. You can really hear the middle lobe very well under the right axilla, and also anteriorly. You can hear the lower lobe sounds better posteriorly. Okay. And so I heard no adventitious breath sounds, and I heard no abnormal sounds for you to hear at all. Okay, I'm gonna do a test. It's a voice test here, and there's 3 of them: bronchophony, agaphony, and whispered pectorology. I'm gonna say that wrong. Whispered pectoroloquy is the way you say it. Okay, the first test is when I say 99, I want you to say 99 every time I place my stethoscope, okay? And the sound should be muffled. If they're clear, it could indicate consolidation, okay? I'm gonna start at the apices here. Say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, we'll do the lateral aspects as well here.
99. 99. 99. 99.
Okay.
99.
Okay. All right. They were muffled. I'm gonna do now. I'm gonna do agaphony, and when I put my stethoscope, I want you to say E. Okay.
Okay.
I'm gonna listen to your the voice transmission will be soft and muffled, and I should be able to hear E. If it sounds like A, then you might have indicate consolidation. Okay?
E,
Okay. Okay. Say it again.
E, 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 E,
Okay. Say it again.
E, 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 E,
Okay.
E, E,
Okay. Lateral aspects.
E, E, E,
Okay.
E.
Okay. The next test is going to be the whisper test. So I'm going to have you whisper 1, 2, 3 when I put this in there, and I should really be able to hear much of anything. Okay?
Okay.
So it should be faint muffle.
1, 2, 3.
Okay.
1, 2, 3.
Whisper.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, that's good. It's very faint and muffled, so that would be the normal. That would be a normal. Okay. Okay, now we are going to move to the interior portion of our exam here. Okay, we're looking for the interior portion. We're looking at the configuration, shape of her thorax, and it's straight. It's midline here. It's and interiorly. I think I did this at the beginning of my thing. It's not sunken. I think I talked about her thorax at the beginning of my inspection here. Okay, we're looking at the slope of her ribs, both interior and laterally, and they are diagonal. They slope downwards, and they're symmetrical. Okay, and her intercostal spaces are even. Okay, we're gonna, just inspecting her, you can see her rate and rhythm is she's got a very relaxed and effortless breathing here. Her rhythm is regular, and her depth is she's got a regular depth. It's not shallow. We tested her respiratory. It was 16 earlier, so she has a respiratory rate of 16. Okay, we're going to look at her intercostal spaces with normal breathing. There's no retractions. There's no bulging there. Okay, and she has no use of accessory muscles. She's not using accessory muscles, which would sternocleidomastoid or rectus abdominis. She's not using those, and she wasn't using any in her back either, her posterior thing. Okay, we're going to palpate for lesions or masses, and for tenderness and warmth. Okay. Okay. I'm going to go above her apices here, and you tell me if it's tender. Her skin is warm and dry to the touch, and I don't feel any masses. Check. And I'm going to check under your axilla as well. I know this may be ticklish here, but I don't feel any masses. See no lesions. Okay? Right? Okay. I'm going to also do the test to check for primitus, and I want you to say 99 when I place my ulnar portion of my hands here. I want you to say 99, and I should be able to feel a vibration.
99.
Let me see. It's not a good angle here.
99. 99. 99.
Okay, that's good. Okay.
90.
Okay.
99.
Okay, that's good. Trying to get the intercostal spaces here.
99.
Very good.
99.
Okay.
99.
Okay.
99.
Trying to find the intercostal space. Okay.
99.
Okay, let me check here too. Vibrate. Okay.
99.
I'm trying to find the intercostal space here. Okay, try to get.
99.
Okay. Very good. Okay. I'm going to check you for chest expansion here, and I'm going to put my thumbs here, and I want you to take a deep breath, breathe in and out for me, and you can see my thumbs move in and out symmetrically. Okay, there you go. Okay. Okay, I'm going to percuss for muscle tone at your clavicles and muscle tone here. Okay, here we go. Oh, this is cool. Okay, and I'm going to do the intercostal spaces, and they should be resonant sounds because those are air-filled areas. And that's what we were looking for is we're not just comparing, we're also comparing the left side to the right side. Okay, sit up straight here, breathing. Okay, very good. Okay, I'm going to listen to your breath sounds, and we're going to listen for any adventitious sounds while we're going here, which would be crackles, or could be wheezes. I'm going to listen for, okay. I'm going to start at your apices here, right here, just apices, top part of your tongue. Breathe deeply through your mouth. Breathe deeply through your mouth. Okay. Breathe deeply. Breathe deeply. Breathe deeply. Breathe deeply. And we do a lateral back and forth and comparing sides. Breathe deeply. Breathe deeply. Okay, and I'm going to do your lateral aspects as well. Okay? 3 sides. Very good. Then get underneath your bathing suit strap again. Very good. Okay, breathe deeply. Maybe the other side. Okay, very good. Thank you. I heard no adventitious sounds, and there was they sounded normal. Okay, I'm gonna do the voice test for you now. When I put my stethoscope down, I want you to say 99 each time I place my stethoscope. Okay. You start at your apices here.
99.
I see.
99.
Okay, that's better. I didn't have good contact there. Okay.
99.
Very good.
99.
Very good.
99.
Very good.
99.
Very good.
99. 99.
Okay.
99.
Okay. With breast tissue, sometimes it's hard to hear.
99.
Okay.
99. 99.
Okay, and I'm going to do your lateral aspects as well.
99.
Okay, say it again.
99.
Okay.
99. 99.
Okay. And
99.
okay.
99. 99.
Okay, very good. Okay, that was bronopony, and the sound is soft and muffled, which it should have been. Okay, I'm going to have you say the letter E every time I place my stethoscope, okay? And I should be able to hear the sound E. If it sounds like A, that would be abnormal. Okay.
E.
Okay, say E.
E. E.
Okay, that's better placement.
E.
Okay.
E. E. E.
Okay.
E. 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 E.
Okay. Try your lateral aspects as well.
E.
Okay. I should have been going back and forth.
E. E. E.
Okay.
E.
Okay. That's it.
E.
Okay. Okay. All right. The last test I'm going to do is the whisper test, and it's called whisper pectoraloquy. And I want you to whisper 1, 2, 3 every time I move my stethoscope. Okay. And normally I shouldn't be able to hear anything at all. Just say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1,
should probably close my eyes. Make this accurate here.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
A little bit better on your bathing suit strap. Try it again.
1, 2, 3. 1, 2, 3.
Okay.
1, 2, 3. 1, 2, 3.
Okay. All right. Well, I think that's all for our exam today. Do you have any questions for me?
No.
Well, thank you so much.